Hello, I am Heather Baumohl-Johnson. I am Arthritis Action's Director of Member Services and Operations. I am also a clinical hypnotherapist. Dealing with chronic pain is sometimes difficult to manage because it not only involves dealing with the physical pain, but also other factors aside from the pain. For example, low mood, memory problems, worries about the future, lack of mobility, social isolation, relationship difficulties, lack of sleep, all of which may lead to us feeling overwhelmed or out of control. Emotional factors and poor sleep can then make the pain feel worse, and it can be hard to break the vicious cycle. Knowing how to better manage your pain means trying to get to know the things that make your pain feel worse. Really, I hear you ask? Yes, definitely, because once we know what makes our pain feel worse, this can help us to better understand what may make our pain feel easier. What makes my back pain feel worse is if I sit in one position for too long, particularly if I am driving a car or travelling on a train. Therefore, when I drive, I try to stop every hour and have a little stretch and walk. And if on a train, have a wriggle in the seat. I may get some funny looks from my fellow passengers, but it means when I reach the destination, I can actually get off the train. I also stand up a few minutes before reaching the station to allow my body to stretch and move. Sometimes distraction techniques can work wonders. They can be fun too, especially as you first try them and explore which ones work best for you. Some of the distraction techniques Arthritis Action members find useful are getting lost while reading a book, watching TV or a film, listening to music, chatting with a friend and doing something fun. When using the following techniques, you can sit or stand, whichever is most comfortable and appropriate for you. There are many different forms of meditation, and many involve relaxing both the mind and the body by focusing on a word or an object, so that the brain can become calm. Meditation has been practiced for thousands of years, and evidence shows that meditation helps reduce blood pressure and pain, and it can also help with depression. Mindfulness. This is when we step out of the past, stop imagining the future, and bring our complete attention to the present, in a particular way and on purpose, focusing on what we are sensing and experiencing in the present, moment by moment. A principle of mindfulness is to acknowledge our thoughts and to understand that they are just thoughts. They are not reality. Our mind spends time going over and over again things that have happened in the past. For example, if I had only done this or that, it would have been different, or I wish I had done that or the other, and it would have been different. Thoughts are made up from information in our head. Some thoughts are less true than others. Our mind spends a lot of time thinking about the future and worrying about what will happen, when and if. So remember to be mindful and acknowledge your thoughts, but let them drift away because they are only thoughts. When we practice mindfulness, we should be kind to ourselves and non-judgmental. Interestingly, when some people focus their full attention on the experience and sensations of their pain, they stop remembering their past pain and they don't imagine future pain. They just concentrate on their current pain, what it feels like. Is it tingling? Is it numbing? And as they allow themselves to fully focus and experience this moment's pain, strangely, the pain eases. Deep breathing. When we are feeling happy and relaxed, our breathing will automatically slow down and muscle tension will reduce. On the other hand, when we feel worried or upset, we often take small, shallow breaths, which can increase feelings of tension or panic. So learning how to breathe deeply and slowly can reduce muscle tension and help us to feel calmer. You can practice deep breathing for a few minutes every day, and once you feel confident, you may use this technique to calm yourself in other situations too. Relaxation techniques. When in pain, we tend to tense our muscles, and this can add to our sense of pain. It is therefore important when in a flare-up of pain to regularly follow a relaxation technique. The progressive muscle relaxation technique can enable you to take control of your body and bring about whole body relaxation. Visualization. Our thoughts can affect how we feel and act, and calming the mind by imagining a relaxing scene can help reduce tension, worry and pain. I hope you enjoyed listening to the theory of some distraction techniques. and I hope you will have fun exploring which distraction techniques work best for you. If you would like to see how 3 of the distraction techniques can be combined, please click into Distraction Techniques exercise.